Good morning everyone. Myself Khalak and I am with Dr. Manu Parmar sir, Professor and Head of Department of Psychiatry at ZMCH Dabur. Now today our topic is obsessive compulsive disorder. So what is obsessive compulsive disorder? An anxiety disorder characterized by recurrent unwanted thoughts that are obsession and or repetitive behaviors, compulsions that cause problem in information processing. Now, prevalence is about 3.3 million adults aged 18 to 54 years have OCD, equally in both male and females. Now, general requirements are like the person must have recognized at some point that the obsession or compulsions are excessive or unreasonable. These recurrent obsessions or compulsions must be severe enough to be time consuming. The obsessions or compulsions must cause a marked distress or significantly interference with functioning or usual social activities or relationship with others. Now, what are common obsessions or thoughts? Obsessions mean thoughts. Repetitive thoughts about contamination, repeated doubts like leaving lights on or leaving the door unlocked. Things or objects needs to be in a particular place or order when the objects are disordered or asymmetrical. Now what are common compulsions like hand washing, so repetitive that they become a rock. Counting how many cards in a deck or over and over again. Cleaning spots on windows, checking the lights to make sure that they are off or lock doors every few minutes. Request or demand assurance, repeated actions on ordering. Now what are associated with children's like learning disorders or disruptive behavior disorders. Now what you can see in adults, there are major depressive disorder, specific phobia, social phobia, panic disorder, generalized anxiety disorder, eating disorders, personality disorders like obsessive compulsive personality disorder, avoidant personality disorder, dependent personality disorders. Like age range, males 15 to 6 to 15 years and female 20 to 29 years, equal in both genders. Obsessions with dirt or germs, hypochondrial concerns like make repeated visits to the doctor for reassurance, obsessions with guilt, excessive use of alcohol or sedatives, avoidance of situations keep to themselves, mostly stay at home. Those who mild cases may be quite successful in life because they are overt conscious and are perfections. Now, what are obsessions? These are recurrent and persistent thoughts, impulses or images that are experienced at some time during the disturbance and intrusive and inappropriate and that cause marked anxiety or distress. The thoughts, impulses or images aren't simply excessive worries about their life problems. The person's attempts to ignore or suppress such thoughts, impulses or image or to neutralize them with some or other thoughts or actions. Now what are compulsions? These are repetitive behaviors like hand washing, ordering, checking or mental acts like praying, counting, repeating words silently that the person feels driven to perform in response to obsession. The behavior or mental acts are aimed at preventing or reducing distress or preventing some dreaded event or situation. However, these behaviors or mental acts either are not connected in a realistic way with what they are designed to neutralize or prevent or are clearly excessive. Now the onset of OCD usually begins in adolescence or early adulthood, occasionally in childhood. Obsessions or cleaning rituals only versus the checking or mixed rituals. Males versus females. Onset is usually gradual. Some acute cases have been diagnosed. They are equal in both male and females. Course of OCD may experience a waxing and waning course. About 5% have an episodic course with minimal or no symptoms between episodes. Progressive deterioration in occupation and social functioning. 90% of patients can expect to have moderate to marked improvement with optimal treatment. Now what are causes of OCD? Parental influence and family rituals not learned. Causes now focused on neurobiological factors and environmental influences. Elevated activity in frontal lobe and basal ganglia. Activity is not typical in people with mental illness. Positron emission tomography scan used in brain imaging. Now what are assessment techniques? These are often office visits, the anxiety disorder interview schedule revised, the Yale-Brown Obsessive Compulsive Symptoms Checklist, the Latent Obsessive Inventory, the State Trail Anxiety Inventory of Children. Now, what are differential diagnoses of OCD? These are anxiety disorder due to a general medical condition, substance-induced anxiety disorder, body dysmorphic disorder, specific or social phobias, major depressive episodes, generalized anxiety disorder, hypochondriasis, specific phobia, delusional disorder, psychotic disorder not otherwise specified. Now, OCD treatment strategies. About 1 in 50 Americans, about 5 million people have or will develop obsessive compulsive disorder at some point in their lives. OCD treatment strategies. Today, the Obsessive Compulsive Foundation says that average OCD individuals spend more than 9 years searching for help and is diagnosed by 3 to 4 doctors before finally getting the right diagnosis. Now, OCD treatment strategies. Many OCD sufferers didn't have access to information about their disorder and were too ashamed or embarrassed to seek medical help. People with OCD usually have considerable insight into their own problems. Most of the time, they know their obsession thoughts are senseless or exaggerated, and their compulsive behaviors are not really necessary. However, this knowledge is not sufficient to enable them to stop obsessing or carrying out the rituals. Education is one of the most powerful weapons needed to battle with this. Now, pharmacological therapy or pharmacological treatment of OCD. These are serotonin reuptake inhibitors like clomipramine, fluoxetine, sertraline, fluoxamine, paroxetine. Behavioral therapy, traditional therapy which helps the client gain insight to his or her problem is not recommended for OCD. A specific behavior therapy approach called exposure and response prevention is effective. In this approach, the patient is deliberately and voluntarily exposed to the feared object or idea, either directly or by imagination. When the treatment works well, the patient gradually experiences the less anxiety from the obsession through and becomes able to do without the compulsion actions for extended period of time. The therapist will usually refer OCD client to a specific in this kind of therapy. It comes down to numbers. The dual cornerstones of effective treatment for OCD are combination of therapy and medication. 90% of patients who underwent behavior therapy with at least 30% reduction in obsession and compulsions. Long-term results from 16 studies show that at a mean follow-up from 29 months, 76% of patients were very much or much improved. Patients who are unwilling to participate in behavior therapy do benefit from only pharmacotherapy treatment, but symptoms reoccur when the medication is stopped. The effective component of both types of therapy is exposure and ritual prevention. What can the family do? OCD affects not only the sufferer but the whole family. Family and friends often have a hard time accepting the fact that the person with OCD cannot stop the distressing behavior. Family members may show anger or resentment, resulting in an increase the OCD behavior. Other times, to keep the peace, they may assist or enable the rituals. Education about OCD is as important for the family as for the patient. Commit to family therapy, self-help books, joints, support groups can be helpful. Now, OCD prognosis. OCD tends to last for years, even decades. The symptoms may become less severe from time to time, and there may be longing interval where symptoms are mild. For most, the symptoms are chronic. With a combination, pharmacotherapy and behavior therapy, symptoms can be controlled. Thank you so much.
Thank you, Dr. Ranjan.